in 2 words, sunrise works. I didn't go into this study saying, let's see if sunrise works. But now that we have everything spread out, camp works, sunrise works. It makes all these transformations in kids' perception of themselves, not only of any camper. Everybody who steps in is just profoundly impacted by the experience. And I am very happy to say, and now we can say it not only because we see it and we feel it, but we actually have the data to say not only it works and not only impacts their lives, but this is how it impacts their lives.
Welcome to the Sunrise Magic Makers podcast. I'm Melissa Carley, and I will be sitting down every episode to talk with the incredible people who have helped bring the magic of sunrise to children with cancer and their families for the last 20 years.
In this special episode, Sunrise Association President and CEO Arnie Preminger sits down with Deddy Paz, PhD student and lead researcher at Tel Aviv University's School of Public Health.
Good morning, Deddy. How are you?
Good morning, Arnie. Perfect. I'm excited.
Great. So I wanted to ask you if you could just take a moment for the viewers to just introduce yourself and tell us just a drop about who you are.
So my name is Deddy Paz, and I'm married to Leroy, and I have 4 children. And these days, I'm currently a PhD student at the Tel Aviv University. And my relationship with sunrise started 16, 17 years ago. And this is how I came into this podcast with you.
So you're actually here because you were the lead researcher in the study that Tel Aviv University recently did on the impact of sunrise. But you also have a history with us that goes beyond that. You were part of the original team, actually, or you were the first director, as I recall, at Sunrise Israel, 15 years ago or so, when we first opened the project in Israel. Tell us a little bit about that. Let's start there. What do you remember about those days, and why you took that on, and what that meant to you?
So we actually, I think the first time that we became in touch was around beginning of 2009, with Sunrise wanting to expand and provide this amazing experience here in Israel. In 2009, I actually came to visit in one of the Sunrise camps in the US, and 2010 was our first summer here in Israel. And what I remember the most is, I would say, the sense of mission and excitement and understanding that we're starting something big and so important and so valuable. And I think also what caught me and got me infected and so motivated was the passion and commitment that I saw from you and from all of your team back in the days. And I think this is what made me very committed to starting Sunrise here in Israel. So that would be, this is what I remember from what I remember the most, just being very, very passionate and excited towards what we're trying to create here.
If I remember properly, this was a bit of a departure on how Israeli children spent their summers. It was also a departure, if I recall, in terms of Arab children and Jewish children working together and being together in the same settings, working out of community centers and Jewish community centers at the time. Tell us a little bit about your personal experience there, and what that meant to you, and and how that entire thing felt. Because not only were you working with children from different sectors, but you were working with children who were sick, some of them critically sick, um, very different than the work you had done previously, if I recall, as a director of different camps. What was that experience like for you?
So the experience I came from, by the time that I was the director at Sunrise, I came from 10 years in the summer camp world, all of them in sleepaway camps. In the US, I was already with 6-year experience as a camp director for a sleepaway camp. But this experience was very, very different from all the reasons that you mentioned. So, and I think in many ways, it was different because of the level of trust that you have to receive from parents and from doctors. It's not the same. These kids are different. These families are different with what they're dealing with. So I think it was the level of trust, but also the camp was so diverse, and you mentioned it. And I think this is part of the magic, but we serviced ultra-Orthodox Jews, secular Jews, Muslim Arabs, Christian Arabs. Some of the kids are very, very young. They don't even speak the language. They speak only Arabic or only Hebrew. So there is all of this, I want to say those challenges that on top of trying to really start something new and create a great camp, you're just dealing with a very diverse population. And I think this is also part of the magic, because when I'm thinking of the things that really made us emotional and gave us the strength to keep on going, is just seeing those kids every day. And when they get to camp, when they get off the buses and they step inside, the campground, you don't see them as different kids. These are just kids, and they're playing together. And I don't know if it's in my mind trying to convince myself or is it true, but you do not see the illness. You do not see the challenges. You just see kids being kids, playing with each other. And, languages were different, but it was not a barrier. The kids just played together. And in that sense, I think it not only affected the kids, but it also meant that we had to find counselors from different parts of the population in Israel. So we had to have Arab counselors and ultra-Orthodox counselors and secular counselors. And we had to adapt the activities sometimes to groups who are separated, where boys cannot be with girls at the same group. And so it just created, I think, it impacted not only the kids, but I think everybody who was involved in this project started to look at the Israeli society as a whole a little bit different. And it stayed with all of us. So in that sense, I think all those challenges was a blessing, because we grew as people.
I remember being there. I think it was the third day of camp that I came to Israel to see the camp. And I was particularly struck by the counselors, who came from all sectors of Israeli life, as you just said, who were referring to the camp as our camp. And I remember the language very well, because there was a sense of ownership of it, regardless of who you were. And I saw, things that you don't see in the general media a lot, where Muslim counselors and ultra-Orthodox Jewish counselors were working together and helping one another with the children, and they were all bonded together by the fact that they had a shared purpose, as opposed to the things that we see in the media all the time. So I was very taken by that, and every time that I visited, I've still been taken by that. I think that what you just pointed out, which is that it's part of the magic, I mean, we see this in the United States and all the camps that we run here as well, where people from every sector of life, every economic background, coming from different communities, they all gather together, and there's one shared purpose that that just all the differences dissipate, and we see them working together towards the good of the children, which is something that was an unexpected consequence of Sunrise, I think, but something that we're very proud of. So let's pick up on that for a minute. And let's see if we can move into the research. So you eventually, I mean, I hadn't seen you in many years, and then surprisingly enough and happily, when we started working with Tel Aviv University on doing this study for us, you appeared as the person who was going to lead the study. And I'm wondering about your personal journey, to become a PhD student and to become a researcher, and whether or not your experiences at Sunrise had any impact on that.
Hmm. Um, so I always kept on with the world of camping, and I kept on going to camp and had many positions in summer camps. I always knew that I want to research. I was always close to the field of education, but it was only natural for me that my field of research would be summer camps. And when I joined the Tel Aviv University, so initially I was supposed to do research at summer camps, but then again, it was very, very surprising to receive an email telling me that there is this organization who wants to run a study. Do you know them? And I saw your name, and of course I told them the story of the first year here in Israel and being the first camp director. So it led us to, doing this study, which was very, very exciting for me. I think, that we haven't seen each other in many years, but I've always been in touch with the team in Israel, always part, with the raising money or being in touch. I was part of the consulting committee for years. So I was always around. And then for me, it was like completing a full circle and actually meeting Sunrise wearing the hat of the researcher. So that was very, very exciting. And I think it had many, many benefits and upsides for me knowing the organization and knowing the world of summer camps, but also, I mean, working during the study, just because some of the people at the organization in the US are the same people that I know from 15 years ago. So I think that the communication, it had a lot of benefits that I had the opportunity and to be part of this part of the research.
So let's just pick up on that for a minute, because research, in order to be valid, right, has to be impartial. It has to be independent. But you came from a bit of a background with us, although it had been 15 years. How do you maintain that level of independence so that the research isn't skewed in any way by any personal bias or by any personal experience that you might have had?
It's a great question. I think I maintain clear separation between my personal experience and my deep connection and how much I love Sunrise to the research process. So I was very, very careful. Also, it was, the study was part of an academic framework at the public health school at Tel Aviv University. And I worked, I had guidance and supervision from two professors, Professor Moran Bodas and Professor Bruria Adini. So, and they don't have, prior connection to Sunrise. So we always kept it very, very professional. We used only validated standardized questionnaires and measurements and tools that are used common in professional literature, and so we just kept it very, very professional throughout the entire process. And I think in many ways, and this is my commitment to Sunrise, because I know the organization, I know that you wanted to get a realistic image of what's really happening and what Sunrise provides and how it affects the kids, and the only way to make the program better for the kids is actually to get the reality. So I think in that sense, it actually was never, there was never a conflict. I mean, it was very, 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 very professional, very academic, very research oriented.
That's great. So let's talk about the study, because, of course, that's what we really, came here to talk about this morning. The study, particularly, when we looked at pre-camp to post-camp, I think that although we had, always thought that the impact that we were making was significant, we never had any data to really back that up. And when we saw the results of the study, which was that there were 7 areas measured, resilience and quality of life and sibling relationships, the ability to manage your own illness, etc. We were just thrilled to see that there were gains in every area from the time that the children started camp to the time that the children ended camp. And of course, this was done with 5 of our camps here in the United States. And so, it's not particular to one particular camp or 2 particular camps. We've had enough across the board that we're able to see that. I'm wondering, did you expect to see that kind of results come out of the study?
So, as you said, you always felt that camp is doing something and it's creating a change. So I think in that sense, when you're asking, I'm coming from the camping world. So I could tell, I see what camp does to children. So I'm expecting, but you do not have the data. And I think data is important. I mean, once you have it evidence-based, then it's amazing. I also, yes, I did expect to see those results, because even in previous research in other camps, you see the gains of participating in a summer camp. But there is also, and this is why I think this research is very important, there are gaps in the literature. So when we're looking at studies that were conducted at camps, and even if I'm looking at kids with chronic illness, cancer or any chronic illness, usually you would have the research conducted on camps that are intervention based, that are running intervention programs. Rarely it would be for both the child who is struggling with sickness and the healthy sibling. So usually it would be only for one of these groups. And if you ever see studies conducted for a mixed group, it's usually with the parents, with the family. So the entire family is going to a place. Usually it's a sleepaway for a few days and they conduct the study. But the gap in the literature is that this Sunrise model, I think it just doesn't exist. You are the first ones that are running a day camp for kids with cancer and their siblings without the parents. And in that sense, yes, so if I'm looking at previous studies, I'm expecting to see a change, but you could never tell until you actually run the study. You could never tell. And as you said, we realized that in every psychosocial aspect that we examined, we've seen improvement, which is incredible. And in that sense, it struck me. I was surprised with some of the findings, which we'll probably discuss, but just seeing. And maybe another thing that I would say, I wasn't sure because I wasn't sure how it would play out and what the difference would be between, the kids struggling with sickness and the siblings. And what we have seen, which was wonderful, and I think, and it shows how important sunrise is regardless right now to the level of the measurements, we have seen that the trends are exactly the same. So camp works in the same direction for both the siblings and the children diagnosed with cancer. So that was wonderful to see that it just works in general as a great day camp.
I think it was wonderful for us to see that as well. When we put together the model so many years ago, when we were originally thinking about sunrise and what it would look like, the siblings were not part of the equation at that point. But the more that we spoke to focus groups, to parents, and to medical professionals who were involved in these children's lives, we started to learn more and more about the impact of the illness on the siblings. And we felt that if this was really going to be a partial answer, if you will, to re-engaging these children in their childhood, the siblings had to be part of it. Not only part of it, but an equal part of it. Right? Sunrise was never built as a camp for children with cancer, and the siblings as an afterthought. It was built as a project, if you will, for children struggling with cancer, whether you are the diagnosed child or the sibling. And I think that, we were thrilled to see the results of the study in that area as well.
And
Deddy,
just to add
please.
to this, Arnie,
Yeah.
which is interesting. So I would say that part of the results, that the outcomes were that we have seen in the results that actually campers who had their sibling at camp showed higher levels on each and every aspect that we examined, meaning there is value of sending the siblings together. So even that is shown in the study.
I think that's another one of those unintended consequences.
Exactly.
Because we had when we included the siblings in the project, it was with the hope that the siblings would gain, but we didn't think about the fact that perhaps the diagnosed child would make gains based on the fact that the sibling was there as well. And I think that's a critical part of the study that came out that gave us information that we hadn't been aware of. One of the things that I think has really impressed everyone was the issue of resilience, right? There was tremendous growth in the area of resilience during the camp season, but in a second study that you conducted, which was 12 weeks later, we saw, particularly with the diagnosed child, right, resilience maintained itself at the post-camp levels, which is something that you had, paid particular attention to and um, I think made a significant note of that because it was so unexpected in some ways. Can you just talk a little bit about what resilience is in a child and why it's so important, particularly for children who are dealing with a chronic and dangerous illness like cancer, to not only build their resilience but to maintain it?
Yes, definitely. So in general, resilience is defined as the ability to recover quickly or to bounce back from difficulties and adversity, and it's the ability to maintain psychological stability and emotional well-being when you face challenges. So this is, I would say, this is what resilience is, and just by the definition, it's important for anybody, but especially for children with chronic illness, and you know what, even the families who by default are living in an unstable and very challenging reality. So this is this is big. if I'm looking at, and maybe just to touch a little bit about what we actually found in the study. So in the study, we found statistically significant improvement in resilience uh, uh, after participating at the camp. And I want to understand what it means when I say statistically significant. It means that it is not random. So there is 95% chance that if we redo the study, we'll get the same results. So from from research point of view, camp works. And as you said, we went back to those children with questionnaires and examined it again 12 weeks post camp. And we're very surprised to see that they actually maintained the level of resilience that they got to at the end of the camp. And the reason it's so unique, because usually in any intervention programs with psychosocial measures, what you would see as it usually works for the short term. And then when you go back in the long term, you see that it decreased again. So maintaining the level of resilience, or for that, for the sake of the discussion, any other measured variable is very, very unique. And everybody were surprised. It's not only us. I think everybody on the team were very, very surprised to see that that it hasn't decreased. And if we're touching on resilience, do you mind? Because there are other things that we discovered about resilience and participating at camp, which I don't know, which were, I don't know if surprising, but definitely exciting. So the first thing was that we found association or correlation between the number of years that a child is returning to camp and the resilience level. And we actually found out that when you go back to camp year after year, your resilience level is higher than of campers who are not returning to camp. And so the consistency in participation at camp actually builds resilience over time. We have not found association with the age of the camper, meaning the gains or the effect of camp on resilience works with the older kids and with the younger kids. So whenever a child is coming to camp, they benefit. And I think the third thing that we found that was interesting is that we didn't find any association between the number of days that a camper comes to camp, I mean the length of participation, to the resilience level. And it means that even if someone cannot come for a very long period of time, just for 1 day or 2 days or 3 days, no matter what, it is important to come to camp and to return the following year, because and this is when we take those outcomes all together, it just shows how important camp is, and returning to camp, and just if you can come to camp, because it builds resilience over time.
You know, it's wonderful to hear that, because for so many years, actually from the very beginning, um, we have been dealing with children who are, in the midst of chemotherapy, who are dealing with the illness, not in remission necessarily, but in active treatment. And for many of them, they end up hospitalized at various points, and so they've been unable to come to camp on a regular basis. And there have been situations where we have worked with the families just to get the child in for one day of camp, because it hasn't been medically safe for them to be able to come for the long term. And we've always talked about the importance of that day and how that one day can really change their perspective and change their thinking about what their summer was like, and lead to a very powerful memory that goes way beyond the one day. But again, that's all been anecdotal for us, and this has been based on conversations that we've had with parents and with the children, after the fact. But this, now to see it actually in the research that tells us that the impact that sunrise makes on these children, it's irrelevant whether or not they're coming for the full summer or for one day. That is so meaningful to us because it's something that we've always strived for, to get those kids in, whether it's for 1 day or 2 days or 3 days, whatever we can, to just give them a taste of normal childhood, if you will, and to move them away from the cancer community just for those few days. So I think this to us was a tremendous validation of what we've always cared about and what we've always done.
And I will tell you that if we're trying to find the link between, my early years as the camp director at Sunrise Israel and the research, this is something that immediately popped up for me when I saw it, because I know these conversations from even before we started. And I was just, it has always been a gut feeling, but we could never tell people we know it's significant, even that one day. So in that sense, it was also, it was also great for me to see those results, and especially understanding what it means. So
Yeah.
definitely.
So, Deddy, let's talk a little bit about some of the results, because I think there were other pieces that really not necessarily surprised us, but that we were just so happy to see. One of them had to do with stress and anxiety, right? Because this was a particular issue where diagnosed children came in with higher levels of stress and anxiety than their siblings did. But what the study showed was by the end of camp, the diagnosed child actually had lower levels of stress and anxiety than their well sibling did, and that was something that we had not expected to see. Can you talk a little bit about that? Why that might be and what that means?
Yes. So I would like to start, if that's okay, just with explaining maybe shortly of what we found out in the research, and then I'll address your question. So for stress and anxiety, what we have seen is improvement for both the siblings and the kids struggling with cancer. And again, it was statistically significant. So it is not a coincidence. And if we run the study again, we'll see those results again. I think it is not surprising. And actually, I will say there is a difference with stress and anxiety. We have seen difference between the groups, because actually the diagnosed kids, the kids struggling with cancer, their result was very significant, statistically significant, and significant. The decrease in stress and anxiety was tremendous. We have seen decrease, which is improvement, of course, decrease also with the siblings, but it wasn't statistically significant, and it wasn't as profound as we have seen with kids with cancer. I think it's not surprising that we've seen kids diagnosed with cancer starting the summer. Their baseline measurements were higher than their siblings. And I would say it's probably because of the reality of medical uncertainty, frequent hospital visits, maybe a sense of being different. So it is expected that their baseline their stress and anxiety will be higher. We were surprised to see how camp impacted that aspect in their lives. And as you said, they dropped to actually lower levels of stress and anxiety in comparison to their siblings. So the siblings showed a decrease as well. I mean, there was improvement, but with kids struggling with the disease, it was again incredible. And just to say, uh, 3 months later, there was still an improvement. So there was a little bit of a decrease, but we still saw that camp worked even in the long term. So
We've always strived, and this was from the very beginning, as you'll recall, to create an environment for these children that is normative, if you will, right? That you would find in any other camp. We make adjustments behind the scenes, so the volleyball is not as hard, and there are certain games we don't want the children playing so that they don't crash into each other and maybe break the port that they might have in their chest for chemotherapy and all of that. But we try not to go over the top. We try to just create a joyful place where children can experience what other children experience. I'm just wondering, just from your professional view, um, whether that has led to some of the results that you've seen. The fact that we are just really creating normative experiences which children are supposed to have.
So I will say it, and again, because I'm trying to wear the hat of the researcher right now. So the study that we conducted cannot determine the exact reasons of why we have seen the changes, why we have seen the decrease in stress and anxiety, or the enhancement of resilience and well-being and quality of life. I mean, all of those aspects, we can see that camp made a difference and a transformation within the kids, but we don't have the tools within that study to determine the exact reasons why it happened. But there is, if I'm looking at professional literature and based on prior research, so there are a few explanations to why those changes happened, and it has a lot to do with the environment. Those kids, they're usually different, or and now when they're in this surrounding with a peer group of equals, children who understand them, you know, siblings of who understand them because they're just living through this reality. And it may be the only, the only setting that they can feel completely normal and fully included. And that means a lot. I think, again, they're coming to camp, and you described it, where the focus is not on the illness, but it's only, the focus is on being kids. And they're surrounded with trained counselors who are there to make sure that they're safe and having fun. And they know that they have medical staff that provides support and they feel safe. So when I'm taking all of this into consideration, and then when it's happening outside in the woods, and they just, breathe and they experience the outside. So all of these elements together create this amazing setting and infrastructure that enables them to grow, and that enables them to experience transformation. So I think that would be, and again, this is not based on the study that we just conducted, because it doesn't tell us what the reasons are. But when we're looking at, at literature and other studies, I would say this is the main reason why.
Okay. So let's talk just a little bit more about the study that you conducted. because I think there's so much information in there that we want to unpack. So we talked about stress and anxiety levels, and we talked about resilience, but we also saw improvements in areas like quality of life, relationships between the siblings, illness management, right? The ability for the child to manage their own illness. Can you talk a little bit about some of the other, positives that we had seen, and what they mean for these children?
Um, Definitely. So in many ways, um, there many of them are linked together, and it's based on research, but also it would make sense when I say it. If your stress and anxiety decreased, and your quality of life is higher, and you're more resilient, then there is linkage to the way to your illness management abilities. So it is all making sense, and of course the literature supports it. So they're all in many ways are linked together. We've also seen it, by the way, in the research. We've seen how those all those aspects are correlated in a way and are changed together in link with each other. So it's not surprising in that sense. And when we're looking at quality of life, so quality of life as it is also part of the measurements when we are trying to measure health-related quality of life. So all of these aspects that we improved are, that improved, the improvements post-camp are definitely affecting, the perception of the kids of their ability to manage the illness, in example. We've also seen, you were talking about siblings relationships, and again, improvements for both short term and long term, which is incredible. Again, no decrease over time. But what's interesting, it's actually there was a difference also in this aspect of sibling relationship assessment between the siblings and the kids struggling with campers. And actually, the levels were higher among the siblings. So the siblings, for some reason, it's great anyway because it works both ways. And but for them, it showed greater. They assessed their relationship with their siblings with tremendous improvement. I will say about illness management, because this was one of the main elements that we wanted to assess. And for illness management, we were discussing earlier about the long-term effect of resilience. With illness management, it was even more shocking, because with resilience, it improved during camp and then remained stable and didn't decrease. What we have seen with illness management for the campers struggling with campers, but also the perception of illness management by the siblings, how they perceive their sibling ability to manage their illness, it improved during camp time, but it not only remained stable following 3 months after camp ended, it actually showed an increase. So it kept improving. So in that sense, I think all of those elements are kind of linked together, but all of them eventually are impacting the children. So
That's great. It's great for us to hear all of this, because it really validates everything that we've been doing. And of course, there was a lot of information right in the studies, far more than we can get into in one podcast. But some of it also informs us as to what we should be doing as we move forward strengthen, those areas of improvement, and where there wasn't as much improvement long term, because children do go back into their lives, and they face the same issues that they face, pre-camp. There are opportunities now for us in year-round programming to try to, strengthen them and to give them, more ability to be able to manage, as they go through this very difficult journey that children shouldn't have to go through. Um, so just to sum up, I think that I'm very drawn to a comment that you made in the research itself as you were summing up, and I don't have the exact quote in front of me, but I recall you're saying that Sunrise made a profound psychosocial impact on these children. If you had to sum up, what you learned and what you saw, how would you sum it up?
In 2 words, Sunrise works. So if I had to, it was never the intention. I didn't go into this study saying, let's see if Sunrise works. But now that we have everything spread out, camp works, Sunrise works. It makes all these transformations in kids' perception of themselves, and so I would say, I mean, this is, and I think this is what struck me, and just seeing that it's not even some of it works and some of it doesn't. It works. Yes, are there any elements that maybe if we wanted to create a very designated intervention program in order to enhance X? Yes, we could probably some of them. Camp works better for some, but it works. And it has this amazing impact, not only of any camper. Everybody who steps in is just profoundly impacted by the experience. And I'm very happy to say, and now we can say it not only because we see it and we feel it, but we actually have the data to say not only it works and not only it impacts their lives, but this is how it impacts their lives. And I think, it's an ordinary day camp, because we're always trying to say it's an ordinary day camp. It's just a day camp, but it does really extraordinary things for campers who need it the most. And so I would say Sunrise, if you want to sum it up, that is my version. Sunrise works, and maybe it's an ordinary day camp, but it does extraordinary things. So
I think that's a perfect way to end this conversation. And so I want to thank you. We've been speaking with Deddy Paz, who is the lead researcher from Tel Aviv University School of Public Policy that did the 2024
public
study.
health, Arnie, let's
Public
record
health,
this again.
excuse me.
Public health.
We'll do that again. We've been speaking to Deddy Paz, who is the lead researcher for Tel Aviv University School of Public Health. And they did the 2024 study at 5 of our camps to measure the impact of Sunrise. And what you've heard this morning, I think, really sums up what the power of the organization is and the impact of the programs that we operate for the benefit of children with cancer and their siblings, and actually for the entire family. So, Deddy, thank you for being with us this morning, and we hope to do more work with you in the future.
Thank you, and thank you for the opportunity, and I'd love to. Thank you very much.
Pleasure.
Bye.